Hello, my name is Katie McAllister, and I am joined with Raj Thakur, and we are currently undergraduate students with the University of Iowa in our second semester as senior research assistants in the study. The Exercise is Medicine program led by our university focuses on the relationship our theory-based, student-delivered health coaching intervention has with improved health outcomes. The Exercise is Medicine program works to encourage healthcare providers to include physical activity when designing treatment plans and to refer patients to evidence-based exercise programs. There are multiple well-known benefits associated with regular physical activity. However, despite all the benefits of physical activity, there is a trend of adults not meeting the recommended physical activity levels. One potential solution to increasing physical activity levels in adults is to administer health coaching. In a 2017 study conducted by the George Institute for Global Health at Sydney Medical School in Sydney, Australia, researchers found that in populations of 60 years and older, after meeting with a health coach regularly, participants had a small, significant increase in their physical activity levels. This suggests that there is a potential benefit to researching the correlation between health coaching and physical activity levels further.
The purpose of the intervention was to evaluate the acceptability and efficacy of a theory-based student-delivered health coaching physical activity intervention among overweight/obese inactive adults. To ensure proper evaluation, we measured physical activity, biometric health outcomes, theoretical constructs, and program satisfaction. In order to participate in this intervention, you were either referred by a healthcare provider or responded to a community advertisement email. Criteria needing to be met to participate included being between the ages of 18 and 80 years old, being at or greater than a BMI of 25, not currently pregnant or have the intention to be, currently physically inactive, healthy enough to engage in moderate intensity physical activity, and motivated to complete a 10-week program. The basis of the intervention was conducted through three main avenues of change: weekly meetings with a trained student health coach, weekly Fitbit challenges and group activities, and educational material regarding physical activity on Healthy. The process of measuring physical activity was done with an active PAL for 5 continuous days at baseline and following the 10-week intervention. Biometric measures were taken mainly through a blood pressure cuff and a tape for waist circumference and an in-body for body composition measures. Theoretical constructs and program satisfaction were measured through a self-report questionnaire. All differences between pre and post intervention measures were calculated via a paired t-test. The average demographic of our population were middle-aged white women with a college degree in the upper middle class of income. We saw an improvement of overall physical activity in terms of steps, which increased by 31%. Notice this increase is transitioning individuals from the sedentary to active population, which we know holds the greatest health benefits in terms of the dose-response relationship between activity and health. Along with this came a decrease in sedentary behavior in terms of sitting, with an increase in overall activity score. The health outcomes most prominent from this intervention were that of reduced fatigue and better general health. No significant changes were seen in the biometric measures, as this is expected from a shorter intervention. Constructs from the multi-process action control theory, such as identity and behavioral regulation, improved, meaning individuals were more likely to identify as active and put forth more effort to exercise. Concerningly, the amount of decisional intentions to exercise per week decreased. We believe this could be due to the participant being more realistic after speaking with a trained student health coach.
During our post-intervention appointment, we had participants complete a survey regarding how satisfied they were with our study. Participants were highly satisfied with the advice received from their health coaches and the Fitbit activity monitor. One aspect with lower satisfaction was the Fitbit community group. In an attempt to improve satisfaction for this semester, we have implemented weekly prompts initiated by research assistants to increase interactivity between participants. Despite having high satisfaction with our study, it is important to note the limitations. One limitation was our small sample size in the spring 2021 cohort, totaling at 14 participants. Another limitation is that this is a single-arm study. We do not have a control group of individuals who did not receive health coaching. A potential variable influence on physical activity could be seasonality. Warmer weather towards the conclusion of our study could have increased participants' motivation to increase their physical activity levels. While we are repeating the study in the fall semester, we hope this limits the potential effects of seasonality on physical activity. In order to confirm our findings, we will continue to repeat our study in larger, more diverse groups in the future to compound these limitations.